All right, we have with us Dr. Nathaniel Berg, who is the chairman of the Physicians Advisory Group. And Doc, I guess you guys are preparing for what might be the inevitable arrival of the Omicron variant. Can you explain?
Yeah, Nestor, thank you very much, and thank you for having me on this evening. The importance of Omicron cannot be overemphasized, except by saying we don't know what comes after Omicron. That is, we want to emphasize the need to get ready now for Omicron, but we feel there is an urgent need to get ready for not just Omicron, but the potential for another variant. The Physicians Advisory Group met last evening, and after a thorough discussion, there was a unanimous decision to make sure that we get out to the public the Physicians Advisory Group's feeling that there is an urgent need for Guam to get prepared for Omicron and whatever variant may come after that, because we do not know what the impact will be. None of us expected that the Delta virus would have a significantly different infectious rate with children than the original, now called Alpha variant. We found that out after the fact. And so there was an urgent need for the FDA and the CDC to quickly decide, can children get vaccinated? Now we know we can vaccinate children. We know we can do so safely. So we feel that we don't know. We know that Omicron is far more infectious. We see that in adults, so far, looks okay. People are getting sick. It's far more infectious. But if you're a healthy adult, it seems okay. The issue is we don't have big enough studies yet to know that that is true. We don't have enough information to know if it's infecting children at a higher rate, but it seems to be. It seems to be that younger children are getting infected more. We don't have enough data, but what we do know is that we have an ability to get protected. And we want the children of Guam to be as protected as can be. Right now, what we feel from the Physicians Advisory Group is an urgent need for the Department of Education to make those vaccinations available to every parent that wants their kids vaccinated. And there's a unifying place where that takes place, and that's at the schools. Otherwise, we end up having it that those who have financial resources, who can drive, who have an ability to drive on a Saturday, they can get their kids vaccinated, whereas the less fortunate, the more vulnerable families who may not speak English well, may not have a car, may not have an ability to take children during the evenings or after school, that those are the ones who will suffer. And we absolutely feel that we need to treat every child on this island equally. And the one place that is done is that every child has an opportunity to go to school. The private schools are on board with finding ways to get an opportunity for every parent who wants their children to get vaccinated, to get them vaccinated. DOD has, the Department of Education has logistical challenges, but they need to meet them. And the government of Guam is offering to help, and that's in part based upon the Physicians Advisory Group making sure that every level of government, including the Department of Public Health, who's in agreement with us. The Physicians Advisory Group has made it known to the governor's office and to the Department of Public Health that we feel there is absolutely an urgency on the Department of Education needs to take every step, conquer every challenge, and make those vaccines available to every single child. Fortunately, the Department of Public Health, their leadership is in agreement with us. The front office also agrees with us regarding the need for an urgent availability of vaccines, that we make with urgency a availability of vaccines for every child. The same can be said for the third dose. We are incredibly well vaccinated, but we're not incredibly well protected. Everybody needs to understand that now is the time not to become complacent, but now is the time to say, okay, let me find time to go and get my third dose of Pfizer or Moderna if it's been 6 months, or my second dose of Johnson & Johnson if it's been 2 months. That is an urgent need for people to protect our community. And again, we emphasize the need for people to do it if we want to continue to loosen up mandates and do so safely.
Okay, Doc, and you say urgent, so how soon are you going to be able to roll out this new vaccination program?
The vaccinations will be available through the Department of Education now are available, and they're available at various places like American Medical Center and the SDA clinic, and at private clinics like IHP and Take Care, as well as our place, for example. Everybody who wants to give the vaccine is able to do so. So you can get it through your private doctor or through one of the other outlets that I mentioned. But what we need is for the Department of Education to, within 10 days or so, make it available. A big component of that is that we have FEMA nurses here now. They're going to leave, and we need to take advantage of the fact that they are available and can administer the vaccines. Also, the National Guard is, at least currently, only going to be available to the end of the month, the end of the year. That's why we need this to take place fast, because we have an ability to get into everybody's arms now. So I would say, Nestor, that this urgency has been expressed to the government and to specifically the Department of Education, and we want the community support in taking advantage of it once it's available for your kids at school. No child's going to be forced to do it. That's not the plan right now. The plan is to offer it to children and through their parents. No child get vaccinated without the consent of their parents, but we're asking every parent to think very long and hard about the fact that we don't know what the next variant could possibly do to children, or for that matter, for the elderly.
Yeah. Is there any thought at this point to tighten up restrictions again?
No. And that's where I think people need to say, thank God. But the reason is today we're doing fine. Everybody smiles, I hope, and has maybe a little sigh of relief to see that our CAR score is below 1, that we're going to be removed from the dangerous destination list. It's all great. But if we don't get protected, if we don't get the children vaccinated and the adults fully protected with that third dose, we may be singing a different story soon. It's not that I'm saying, oh, I'm so frightened of this. What I'm saying is we have an opportunity right now to get really well prepared. That opportunity goes away as soon as a new variant is here and is running crazy through the community, as did the Delta. You can't do it at that point. You then need to tighten up restrictions. If we get prepared, we can avoid that and continue to enjoy the freedoms we have now while getting back more and more of them because we've done so well. That's a community-wide effort that we need to start. I've already let all of our employees know, and encouraging the private sector to do the same. Give people time off. We're giving people time off to take their kids now, but that's a luxury that some can't afford. So that's why it needs to be in school. We want everybody to get it done, to be prepared.
As of this interview, we have heard that state of Hawaii authorities have confirmed that there is that variant has reached their shores. Do you think it's already here on Guam, or is inevitable?
I would say probably not would be the answer. But I think everyone watching KUAM tonight knows it's coming, right? The same as Delta came, but this time we can take a different course as a community of Guam, which is be prepared, stop it from doing what happened last time. I will say I'm an incredibly proud Guamanian of how we handled this. Right? Everybody can toss out criticism, but the reality is that our restrictions weren't horrible, and the hospitals never got completely overloaded. Full, yes, but never completely overloaded. I am asking people on behalf of the Physicians Advisory Group to pay careful attention to the fact that we have an opportunity right now to get prepared, and that could lead to a very different story, an even better way of encountering a new, very infectious variant. And that, especially for those who elect not to get vaccinated, is to say, this is another opportunity to try and avoid something bad from happening. It's been the majority of people who are unvaccinated are the ones who went to the ICU and were admitted to the hospital. And we're saying, think again. We're saying this because we care about you. Nobody's angry. I hope not. There's no reason. It's a freedom of choice. We live in a free country. But I'd say, please understand that the reason we're emphasizing it now is this new variant may be more dangerous for the unvaccinated. We simply don't know. And we're saying now is the opportunity to really think hard about yourself, maybe talk to your loved one who's elected not to get vaccinated, and say maybe now is the time to finally go ahead and do it to protect yourself and your family. So that's the difference. Is it here yet? I hope not, Nestor, but if it is, we're hoping that it's not, that there's not much out there, and that we still have time to be prepared.
And so there's no thought of like reimposing quarantine restrictions on inbound international travelers or even stateside travelers at this point?
No, we think we have time to get prepared, but we've got to move very quickly. That's the reason that I use the word urgent, is to tell people you need to go as quickly as possible, get your kids vaccinated. You need to go as quickly as possible, get your third dose if you haven't had it. And
All
that
right.
would keep open. If we continue to, I apologize, and I didn't mean to interrupt you, but we have our low numbers. We want to keep them that way, right? And that if people do get infected, we can see right now that those who, at least preliminarily, those who have been fully protected do okay with this new variant. It's those who are not fully protected, who haven't had their booster, children, and others who might be unvaccinated. Those are the ones that we're worried about.
All right, that's Dr. Nathaniel Berg with the latest on the Omicron variant. Thanks, Doc.
Thank you very much, Nestor. Take care.
All right, you too.